Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, March 23, 2021, and we are more than a year into giving you COVID updates. This is your opportunity to ask questions directly about COVID, about masks, about vaccines, about what you should do, about predictions. We will take what you want to know. So you can put questions directly into the box below on Facebook or Twitter. You can also use the hashtag AskDrArwady. So while you are getting those questions in there, as always, let's start with a look at the data. And chicago.gov/coronavirus is your one-stop shop for everything related to COVID. And you can get to the data section directly by going to chi.gov/COVID-. And for those of you who have been following along, as we pull this up, we see real signs of we're at 3.2%. Still a good positivity rate. We're in that lower risk category, but that is up from a low of 2.7%. And seeing that go up about a half a percentage point over the last week and a half to 2 weeks is not progress. Our testing looks good. We're still doing 12,325 tests per day. You can see that's up about 6% from last week, but our case counts continue to rise. We're now averaging 350 cases per day, and let's just put that in some context. So a week ago, we were averaging 285, so that's up 23%. Sometimes people ask, isn't it just that you're doing more testing? No, because if it were just testing, we would see testing up 23% and cases up 23%. This is a true increase, and the concern is that we've been sitting pretty comfortably under an average of 300 cases per day. Here in Chicago, with our population, to get down to a lower risk state, not even a controlled state, just a lower risk state, we need to be averaging fewer than 200 new cases per day. And for us, being over 400 new cases per day is a real sign of concern. If you've been following along with our reopening metrics, you'll note that we've set these levels for things to be concerned about. And although a level of 350, we're still in that moderate risk in terms of the number of cases. We actually are in high risk because of the rate of increase. If we see an increase 5 days in a row, at least 10% over the prior week, that does push us up to a high risk there. And so at this point, the cases are in a high risk state because of the increase. Our positivity does remain in the lower risk state, but heading the wrong way. And then our emergency department visits, which had been in a lower risk state, are also back in a moderate risk state, because consistent with the increase in cases, we've also seen some increase in people presenting with COVID-like illness to the emergency department. Our ICU numbers and our hospital numbers at this point do continue to look good, but I will tell you, we are worried about this. And I'll show you, if you're curious, we actually have a press conference this afternoon at 1 o'clock, and we'll be talking in some more detail. But let me show you, if you want to explore for yourself what's happening. You can go to daily by demographics, and then say you want to say just what's been happening in the last couple of months, and let's say what's happening with age. And if you click on age here, this will bring this up, we'll blow it up. And you can see that what we're really seeing in terms of increase here, this red line on the top are people 18 to 29 in Chicago. The light blue is people 30 to 39. The yellow is people 40 to 49. And so it really is our younger adults in Chicago that are driving this increase predominantly. The good news is down here in gray and in pink, that's our people who are over 70 and over 80 who have been most vaccinated. And it's good to see those rates remaining relatively low. We are at now more than 50% of Chicagoans over 65 having gotten at least a first dose. I want that number a lot higher. We're not done yet. So just straight off, if you know anybody over the age of 65, anywhere in Chicago, please, 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 let's get them a vaccine. You can call 312-746-4835. That connects you to our COVID helpline, and we are holding appointments, for example, at the United Center for anybody over 65, anywhere who lives anywhere in the city of Chicago. We will see what happens related to more severe outcomes. In a best case scenario, This does not continue significantly, and we don't see these cases in younger people turning into major increases in hospitalizations. However, I know that a lot of younger people do interact with people at higher risk for COVID, people who are over 65, people who have underlying conditions, and we are really concerned about that. On the good news front, if we do the same thing here, I like just showing people how to do this yourself. If we just look at, say, race ethnicity data, you can sort and say, you know, I just want to look at like the main groups here in Chicago: Asian, Black, Latinx, white. And then we blow that up a little bit. You can see here that really we're seeing very similar rates. These are rates, so you correct for how many people have this reported race or ethnicity in Chicago. You can see that the rates are very similar. Earlier, we were seeing much higher rates of cases in Latinx communities. Done a lot of very aggressive vaccinating in our highest risk communities there, and in that setting, you know, over these last couple of months, have seen that come down really well. Also, continued good adherence to masking, social distancing, and so the highest rate of cases in red here is among white, non-Latinx Chicagoans, and we're seeing some increase, you can see in purple here, in both white and Black non-Latinx Chicagoans. But really, this is not being driven in a focused race ethnicity way. It's being driven more in an age way. We're not seeing any significant difference in gender, so you can explore that if you like, but similar rates among men and women. Women get tested a little bit more, so when you correct there's nothing significantly different. So this is really concerning, and you know, our goal is to keep being able to turn that dial on reopening, but where our cases move into that high-risk territory, and we're seeing the other indicators really move the other way, I do have some concerns. I want to put this in some context. I don't have, you know, I'm very confident that, you know, this summer, for example, unless we really see major surprises with new variants, et cetera, you always have to put a little caveat on it. I remain really confident that this summer, assuming we continue to see really good vaccine demand and really good uptake as vaccine supply increases, we'll be in good shape this summer. But I am really worried about this next sort of 4 to 8 weeks, where still, although we're making great progress on vaccinating people, we've got, you know, more than 1 million doses Chicago providers have put into arms. We're closing in on 1 in 4 Chicagoans having gotten at least a first dose, which is really great progress. Nevertheless, fully vaccinated means 2 weeks post your second dose. And where we talk about the percentage of the population that's gotten 2 doses, or fully vaccinated if they got the Johnson & Johnson, we're only talking about 11% still of the full population, about 16% of the adult population who are eligible, about 30% of those over 65. And so we are not at a point where we can assume that, you know, most people have started to get some protection from the vaccine, because you know, unfortunately it's not true. So just a reminder to everybody that right now is the time to be doubling down on the things that have gotten us this far, not get ahead of ourselves with the exciting news about the vaccine, and we do need to see those case numbers coming back down. So we'll be talking a little bit more about that at the press conference this afternoon, but I did want to highlight it. We can come off the screen. The other thing I wanted to just give a couple of quick science updates, because it's been a little while since we've been doing that, but we've continued to get questions coming in, and we like to give you the most up-to-date scientific information. So one is there's been a couple of good studies just reinforcing that there are no issues related to mask wearing. We continue to have people who think that wearing a mask will drop your oxygen level, will raise your carbon dioxide level, will change your heart rate in some way. Wearing the mask itself is dangerous for you. That is not true. And there's 2 studies here, one from JAMA Network Open and one from what's called PLOS One, which is a well-known journal. One was looking at actually young children under the age of 2, had them wearing a mask during normal play while they were able to walk or crawl around, did not see, even in those youngest children, any problems with oxygen levels, carbon dioxide levels, heart rate, or respiratory rate. And then a second one that was done in older folks where they were exercising, they were wearing cloth masks and surgical masks, all the different kinds of masks, no problems related to mask wearing. So I hope most people know know that is true, but I did want to share some of the science, and those came out in February and March. So that's the most up-to-date information there. We also continue to get questions about the length of time that people need to isolate after they've been infected. And still, we have people where we've got employers who are wanting to require a negative COVID test before people can come back to work. And let me reiterate, you do not need a negative COVID test to come back to work. That is against the health department's direction. And we've got language on the website. If you're an employer or you are an employer, that shouldn't be what we recommend, because our tests are so sensitive, meaning they're so good, that you can continue to detect some COVID when you swab people's noses, but they are not infectious. They cannot spread it. That's dead virus or just otherwise virus that cannot be cultured, meaning when you actually take the swab and you try to see if you can grow virus, you can't. And so there was a good study in the Journal of Infectious Diseases from February 27th that was tracking people and found that right now, remember, if you have COVID, you have to isolate. You have to stay home for 10 days from when your symptoms started, or if you didn't have symptoms, from when your positive test was. 10 days minimum, and your symptoms need to be basically resolved. And you can return to work at that time. And this was a good study looking at adults 18 to 49, which would be our typical working age population, and looking at children, actually less than 18. And in both cases, this was done in Utah and Washington, they were swabbing people who were not sick enough to be in the hospital, so sort of mild to moderate COVID, and they did not find them to be infectious more than 10 days after symptom onset. The great majority of them, more than 90% of them, you could find COVID if you looked for it, but then when you tried to culture it or you did follow-up, they weren't able to spread COVID. So continued evidence there that those guidance are correct. Really important, if somebody has COVID, they do that home isolation as cases are coming back up a little bit again, reminding people about that, and if you have questions, you can put it in. And then the last scientific study I wanted to just highlight, there's been all kinds of good information coming out, of course, about the vaccines, and they're performing really well in the real world. There's some nice data out of Scotland showing how protective the vaccines in the real world have been, especially against the severe outcomes, hospitalization and death. But there's an interesting article from the Open Forum in Infectious Diseases. Masia, M-A-S-I-A, is the author, and they were looking at patients in Spain and looking to see high viral loads, like if somebody had been very ill and converted, how well did that predict their antibody response, right? We've talked a lot about antibodies, and antibodies are the easiest thing to test in terms of if somebody has had COVID, you can check and see, did they have antibodies? But antibodies are not the entire part of your immune response. And so in this study, they were able to find that people who were sicker, that had a higher level of virus, had a more significant antibody response, more of an immune response. Not a big surprise, but then we're able to clear it eventually. And so it's highlighting that people who get less ill are less likely to have such a robust antibody response. And then the last one is from a preprint, meaning it's not peer-reviewed yet, but the author is Muller, M-U-L-L-E-R, and it was looking at the Pfizer vaccine, again, in the real world, and finding some of these questions that we get a lot from you about, are we going to need booster shots? What is this going to look like? And we don't have full answers on this yet. But what was good is in this study, they looked at both really older adults, like over age 80, and then they looked at younger adults, under 60, and compared not just the antibody level that they got from the vaccine. So this isn't from the virus, this is from the vaccine. They look at the neutralizing antibody result from the vaccine, and they look at this other part of the immune system, something called the IgG response, which is a more traditional immune response. And they found that the majority of adults, the huge majority, did produce both the IgG-specific antibody titers as well as these neutralizing antibodies. And if you've got questions, we can talk about some more details. But what was interesting was that the oldest adults, those over 80, had lower levels of the neutralizing antibody. So about 69% or so of those over 80 had the neutralizing antibody, whereas like 98% of those under 60 did. And so, some early evidence just looking at, these vaccines are super, they're fantastic. They're most important to get to our oldest folks, but there are some questions about maybe for the people who are the very oldest, could this be something that you might need a booster dose for in a year down the line? We don't know yet, but these are some of the kind of research that's being done. In the real world, the vaccines continue to perform beautifully. Their safety is really good. Their efficacy, especially against hospitalization and death, really, really good across all 3 of the authorized vaccines here in the U.S. But some of this behind the scenes science as we continue to understand not just the protection and the symptoms in the real world, but doing some of that research behind the scenes related to the immune system. So we'll share some more of that as it comes out, but I just wanted to give you a sense of some of what the scientists really continue to look at. Okay, let's turn to your questions. All right. Lots of things here. Pamela Quinn on Facebook. Isn't it common sense that cases are going up in ages not eligible for the vaccine? Yes, and it is a sign that the vaccine efforts are working. But it is also a reminder for me, and hopefully for everybody, that there are people in the younger age groups, I think, who perhaps are being less cautious. And whether that's because they're feeling confident that the older people they interact with are already hopefully fully vaccinated, or whether there's just a sense that COVID is over. So it doesn't surprise me to see that the cases are going up in the ages that are less eligible for the vaccine. But the patterns that we're seeing, to be very clear, are the same patterns we were seeing in October. As we were watching with some concern and then moving into that phase, it's been 18 to 29-year-olds, 30 to 39-year-olds, 40 to 49-year-olds at every point here in the outbreak that have been the most predictive of seeing significant increases in cases. And so most of those folks have not been able to get a vaccine yet. And I want to remind people, all people, but especially folks in those younger age groups who haven't been able to get a vaccine, that we really need everybody to not stop doing the things that got us this far. So yes, you're thinking about that in the right way. Okay, Abraham Johanna on Facebook. Can you explain reopening with state and city? Will Chicago follow along with the state in the bridge phase? Okay, so lots and lots of conversations. Certainly our goal is absolutely to be as aligned as we possibly can be between the city and the state. There are some things that we have been a little more restrictive on historically here in the city, especially around some of the highest risk settings where people have to take off masks, setting where social distancing may be more difficult. And really the question for me predominantly is, and for the state too, is are some of these increases that we're seeing signs of real trouble? Michigan is having real trouble from COVID right now. I don't know if you've been following, but they're currently the 3rd worst state in the country related to new COVID cases. They've seen an increase in COVID cases of more than 100% just in the last 14 days. And they've seen an increase in hospitalization too of more than 50%. And they're back to COVID rates like they were seeing around Christmas time, late December. There's been conversations, and you'll note that in all of the reopening guidance at the state level, at the city level, there are some benchmarks in there around assuming that we have stability in all of our COVID numbers. So I think broadly, there will be more coming, but and for people who maybe haven't been following we remain in phase 4 from a reopening standpoint. That's the state's phase 4. And the state has signaled a bridge phase for particularly when a high percentage of those over 65 are vaccinated, assuming all the other metrics look good, a more significant move towards some more reopening, and then have also signaled a little bit of what phase 5, which at the state means sort of more broadly open, and they've tagged that to seeing a high percentage of the state having gotten at least vaccination. And we are broadly in support of those, and will broadly be going along with those. But at both levels, it's all about what are we seeing related to case rates, and so more to come. I was very much hoping today to be able to do some further reopening in the setting of what these numbers look like. We're just keeping a close eye. We've got to come back down to moderate risk in all of our indicators, and the state's in agreement about that too. These increases we're seeing are not just in Chicago; they're actually worse in suburban Cook and the Northeast. The state overall. Not emergency yet, but this is why we monitor these things. And when we see signs of concern like this, it's a moment to watch and see what happens. Again, I'm not concerned about the long term, as long as we continue to see good vaccine rollout and uptake, but I am very concerned about the short term here. Leonore Chin on Facebook, what advice can you give to fully vaccinated parents who are worried about possibly infecting their unvaccinated children under 16? Yeah, really good question. So the most important thing, of course, is that as adults get fully vaccinated, 2 weeks post your second dose or your first dose if you get J&J, getting all of the adults vaccinated is the best thing that you can do in terms of protecting kids at this point. And we are not anticipating that there will be vaccine for children for months and months because the studies are still being done. So we'll see what that timing looks like, but we are not anticipating vaccine even for younger teenagers until maybe late in the summer, maybe the fall. And then we're not anticipating vaccine for younger children, meaning under 12, for much later after that, maybe the very end of the year, maybe even early 2022. And so the good news is that if you think about children, if your child, the biggest question also is, does your child have a significant underlying condition that puts them at biggest risk? I think broadly, if parents have been fully vaccinated, they are certainly, in their own household, not a significant concern. It's more where you're thinking about your unvaccinated kids, what sort of gatherings are appropriate for them down the line. And where I think about my own extended family gathering, for example, this summer, where all the adults have been vaccinated by then. And I do think all adults who want to be vaccinated will be able to be vaccinated by sort of the early summer, June, July timeframe. As long as all of the adults are fully vaccinated, having the kids gather is not going to be a significant concern at that point. If you've got a child who has really more significant risk, you may need to do, some additional precautions there, but broadly that would be the recommendation. One thing I would note, though, is that we are seeing a lot of issues with unvaccinated kids who can't get vaccinated yet. We're seeing some spread in sports teams, and that includes at the high school level, as well as, college and adult. And just making sure your kids are, wearing their masks and doing their distancing. And again, while COVID rates are relatively high, there is some risk there. And as they come down, right, we get closer. Once you get to a point there's not a lot of COVID here, then the risk, even for people who are unvaccinated, becomes much, much lower. And so that would be the advice. I do think in a couple of months here, we'll probably, at the rate we're going here, we've been mapping out with how vaccine is arriving in Chicago, likely sort of by late April to early May, probably at least half of Chicagoans will have been able to get that first dose of vaccine. And that may be even faster if more and more vaccine gets here. But my biggest worry is, we're still sitting here in March, and I think people are in some ways starting to feel like it's July already, and we're just not quite there. Richard Benson on Facebook. It looks like the United Center has appointments opening up for anyone over 18 this week. Is this genuine? All right. So let's talk United Center. First of all, United Center is going beautifully. We are doing well over 5,000 appointments every single day. The operation is going great. We are having absolutely no trouble booking vaccines. So I know there's a rumor going around again because we've been seeing and hearing about it with people saying, oh, they're not filling appointments. Oh, you should use this code that's supposed to be for people in special zip codes because we're opening it to everybody. Not true. Broadly, if you live in the city of Chicago, not in one of the prioritized zip codes, and you are interested in getting a vaccine, remember, we're opening to 1C on March 29th, but where we don't fill appointments with 65 pluses, et cetera, we've opened appointments to people who are in phase 1B plus, who have the underlying conditions. We are posting some appointments on ZocDoc every single day for anybody in Chicago who lives anywhere who is over, who has an underlying condition, who is eligible. But that's a limited number of appointments. So if you get one of those, and it's not just the United Center, right? There's appointments at the United Center, there's appointments at other providers. They remain limited, but the appointments on ZocDoc.com are open for anybody in phase 1B plus. Okay, and if you've got questions about what that is, let me know. But it's anybody who's over 65, anybody who's eligible, and anybody with the underlying conditions. But broadly speaking, we absolutely have not opened the United Center to anybody. And if you do not live in one of the prioritized zip codes and you try to use a code and you attest that you live in one of those underlying zip codes, which is what you have to do through the non-ZocDoc registration way, like, we will not confirm your appointment. And so please trust that if there are changes to eligibility, we will communicate those. But I can tell you for a fact, there will not be changes in eligibility at the United Center. We are having absolutely no problem filling appointments. Every time we put appointments up on ZocDoc, they're gone in minutes. Every time we put appointments up through our community partners and others, we're not having a trouble filling those. Today, we opened the drive-through there. And so one of the reasons we've been doing sort of between 5,000 and 6,000 a day is to have vaccine to also support that drive-through. Those appointments are also booked. So please, don't use a code that you're not eligible for, because it just creates work for us to not be able to confirm your appointment. 1C opens next Monday, and that's when there will be broad eligibility across Chicago. Faith State on Facebook is asking about the drive-through at the United Center. How is it going? Is it open when it rains? What do you need to bring for the appointment? How does it work? Oh, good question. So this is the first drive-through that the city of Chicago is operating. We are excited about drive-through. We know that for people who have cars, for seniors also, who may continue to have some concerns, even though we have all of the COVID precautions in place. But if they have transportation or mobility issues, we think it's an important venue. We really had to wait for the weather to be a little bit warmer, because we looked at this around the region, and there were real concerns. We need to make sure people are being monitored appropriately in the cars. We need to make sure that there are people, even the people who are staffing these need to be out and about. And so now that it is, March, we are excited to be opening this. And so the appointments have been made specifically for drive-through. People who made them knew they were signing up for a drive-through appointment. They are still Pfizer vaccines, and we have basically a system where there's a separate parking lot area that's for the drive-through. So there's clear signage, et cetera, in terms of directing people where to go. And there's the check to make sure that you are appropriately registered. Again, you have to have the appointment. You cannot just show up either on the drive-through or on the walk-up side for the United Center. And as long as people have certified that they're eligible, that's what is needed. Most of the folks doing these drive-throughs are people who are 65 plus. If you'll recall, right from the beginning, when we opened up vaccine at the United Center, it was to anybody 65 plus anywhere in the state of Illinois. And so a number of those folks got drive-through appointments. And we basically, we move people through. You actually get vaccinated. You can stay in your car to get vaccinated. We will vaccinate multiple people in the car if they are eligible. And then you move into sort of a monitoring area. There's a 15-minute and a 30-minute. There's people who are sort of monitoring, watching in the cars. I think there's a kind of honk your horn plan and others in case anybody's having any issues. And then we move people through. So we looked at best practices of how this is being done around the country. We started today doing, I think, 500 cards the first day, and we're increasing up, plan to get up to about 1,000 over these next few days as we learn some lessons and really work on making sure that everything is efficient and rolling quickly, and then we'll go from there. I think if vaccine drive-through is something that people are interested in, and we have a lot of demand for it, and the operations allow us to be very efficient with us, it's something we're interested in potentially doing some more of as more vaccine gets here. So I hope that helped. Katie Ray from Facebook. I'm trying to plan a wedding. When would it be safe to book a venue? Oh, Katie, wedding questions are like one of the questions I have gotten the most throughout this whole thing. So I do think by this summer, broadly, you're going to be able to have a wedding in the way that you want to have a wedding. I would put a couple of caveats on that. Certainly, I think an outdoor wedding, big, no problem, even quite soon here, not really an issue. And if you've got a fully, like if everybody who is, every adult coming to this wedding is vaccinated, we're not worried about your wedding, right? And truly, like in all of these gatherings, you know, as more and more people get vaccinated, if all of the adults are fully vaccinated, we are not concerned about those gatherings. The question will be when you're sort of planning your wedding, I do think you're going to still have to keep some of the COVID in mind. You may have children there, of course, who can't be vaccinated. And if you've got children who are at higher risk, do you need to do, you know, any special thinking around that? And you may have people who have chosen not to get a vaccine. And so depending kind of what that looks like in your party, that would increase risk a little bit. But broadly, yeah, I think if you're planning a, you know, 200-person wedding, I think by this summer, that would broadly be something that you would be able to do. There may still be some, you know, some requirements in place around there. If you had, say, children or somebody who was higher risk and for some reason had not been vaccinated, there may still need to be, you know, some mask wearing at different points. But I think by this summer, you probably will be in good shape to have a wedding, and especially if you do it outside, that really just decreases a lot of risk for everybody. So. Again, I always have to put a little caveat on there that COVID could still surprise us, right? New variants emerging, et cetera. But I'm feeling really optimistic, and that people, you know, I have friends who were planning big weddings this year and postponed them and did a small wedding. And, you know, a lot of them are looking at sort of July, August, September, October as the time to have the party. And I think, especially if your folks are vaccinated, that's going to make sense. Lisa Bowen on Facebook. I'm in a singing group. We have been performing via Zoom, but when can we get together again to practice and perform in person? All right. I love singing groups. I've been in lots of singing groups at different points in my life, and it is one of my favorite communal activities. But thank you for getting together and performing and practicing on Zoom, because that is absolutely one of the strong requirements that we have had throughout COVID. If you'll recall, one of the very first sort of quote super spreader events was at a choir event in the U.S. here from very early on in COVID. And you think about people in closed spaces, you think about singing as being an activity that would have more risk for potentially spreading COVID, and it is a higher risk activity. But the good news is that if you've got a singing group, when I was in college, I was in a smaller singing group. When your singing group is entirely vaccinated, everybody's gotten both doses, I'm assuming, you can gather as a singing group again. Now, this does not necessarily mean, you say you're getting together to practice, et cetera. We're still, when we're at these sort of vaccinations rates and these sorts of COVID rates, I'm not yet talking about if the choir is fully vaccinated, the choir can be in the church and there's no issues, or you can be performing kind of huge concerts just yet. But even right now, when your group is fully vaccinated, yes, you can get together and you can even do things like sing if everybody is fully vaccinated. If there are people who are really high risk for COVID, I would suggest that you continue to recognize that there are people who will have different levels of concerns there, and a lot of us are going to have to be thinking about, in-person versus hybrid. How do we do some of this moving forward over the next few months? But yeah, you can get together in your group, practice and perform if you've got a group around that, and that's really the promise of vaccination, honestly, and that would be true for other small. I mean, I see sort of some other questions and things about other small groups wanting to get together. When everybody can get vaccinated, and again, I think most people in Chicago are going to have the opportunity to get vaccinated. Most people in April and May, so we're talking about early summer here probably, that you'll be able to do that again, and that'll be nice. Jenny Lopresti Abenati on Facebook. How long will homebound seniors wait for an appointment? I signed my 96-year-old grandfather up 3 weeks ago and haven't received a call for scheduling. Okay. We have had thousands and thousands of people sign up for homebound appointments, and I'm glad about that because it's highlighting people who are truly unable to leave home. But as a reminder, I expect that our homebound program is going to take the whole summer to get through, just because Chicago Fire Department, we also have some volunteers from our Chicago Medical Reserve Corps who are volunteering to be part of this, but we have to make sure all of the same monitoring and safety and reporting protocols are in place when we're going into homebound. And so even a really efficient team might be doing 8 or 10 or 12 vaccinations in a day. Is really different than some of these larger sites. And so my biggest ask for you would be for people who are truly homebound, like if your 96-year-old grandfather is not leaving home, his risk is not that high if as the other people in the home are able to be vaccinated. So continue to do the things that you've done so far that are keeping him safe. It sounds like you've been being really careful sort of about him, and keep doing the masking and the social distancing and being careful. Get a vaccine when the people who are not homebound have the opportunity. Do not wait. We've said that we'll vaccinate anybody who lives in the home, right? If we're going and doing a homebound, no problem. But please, get that vaccine, and we will absolutely get to your grandfather. We will get to everybody who still needs a vaccine through that homebound program. But I just want to set some expectations. We've done hundreds of vaccines, but there are thousands of people to do, and it is going to take a number of months for us to be able to get that done. And so anybody who is able to get a vaccine through another way, would also encourage you to do that. But we will get to him. And remember, his risk is really from people who are coming into the home. And that's why we started with a big focus on home health workers and getting them vaccinated, hands-on, in homes, vulnerable people. And then, some of the work now around expanding vaccination will be good for him too. Shirley Robinson on Facebook. Should you take the vaccine if you have sniffles or signs of a cold? When you go to she says, because when you go to the place, they don't give you a COVID test before the vaccination. Correct. All right. I really like this question. If you have sniffles or signs of a cold, there is a good possibility you could have COVID, right? Our COVID rates are on the way up. I don't know what your exposures are, et cetera. Our guidance has not changed that if you are sick, even a little bit sick, you need to stay home and you need to get a COVID test before we can answer that question. So if you are feeling unwell, unless, I don't want you getting COVID. I mean, I don't want you getting a COVID vaccine. I don't want you coming to a COVID vaccination site if there's even a chance in your mind that you have COVID right now. Stay home, get past your sniffles or signs of a cold, get that COVID test, make sure you're healthy. Even for you, that's the best time to get a vaccine. Let me clarify though, that if, say you have persistent allergies, right? Spring is springing, and if you are someone who has sniffles or you have something that's chronic, you've been checked, it's not COVID, you can get a vaccine in that setting. But if this is new, I do not want you, and we definitely do not do COVID tests at the vaccination site. We want anybody who has any concerns for COVID. We do symptom screening, et cetera, and we have all the safety things in place. But if you have any concerns for possibly having COVID, we want you going to a COVID testing site, nowhere near the vaccination site. So, good question. James Dauphin on Facebook. We're just about out of time here. Blessings on the singing question. Happy to hear I love it too, which I do. My sister is actually a professional singer, so she has been out of work for a while here. But yes, so I pay a lot of attention to singing. He's wondering about the possibilities of performing a musical outdoors with an audience and actors next summer. Will we be in good hands to do so? I think so. I think by this summer, an outdoor event, particularly if all your performers are vaccinated, absolutely will be something I'm very hopeful that we will be in good shape to do. So I think some always a little bit of caution there, but some planning around outdoor events. And we're doing that at the city level too, thinking about some of the things that we love here in Chicago. A little bit of adaptation to this, right? We're not necessarily at a huge crowd, but the ability to do some of this with some spacing and some distancing outside absolutely is the kind of activity that we want to bring back here in Chicago. So I'm glad. Okay, Jean Brooks on Facebook. Where should we look for vaccine for my 17-year-old grandson with type 1 diabetes? Your grandson's healthcare provider. So as a reminder, only one of the 3 vaccines is authorized for kids under 18. The mass vaccination sites, the pods, are not where we are vaccinating children, but healthcare providers, especially if he gets specialty care, if he goes to Lurie or goes to Comer or goes to some of the sites that do a lot of the specialty care, we've worked to make sure that those providers have vaccine, and they have already started vaccinating all over the city. Healthcare providers, if they don't have people 65 plus to do, have started reaching out to their highest risk patients. As additional vaccine comes, we'll be working to get that vaccine. But remember, it's only the Pfizer vaccine that's open right now for people 16 and 17, and that's the ultra cold one, so it's really primarily at hospitals. And otherwise, I would so I would say follow up with a provider there, and we certainly are interested and have been working to make sure that some of those hospital-based providers who see not just kids with type 1 diabetes, but kids with cancer, kids with other immune compromising conditions in that highest risk 16 and 17-year-olds can start vaccinating their own patients, and that'll be a significant work too, but through the healthcare provider for sure for people who are 16 and 17. Okay, I think we are just about out of time. And we will be back on Thursday to answer some more of your questions if we didn't get to them today, but good set of questions. In terms of just some updates. So again, we are doing a press conference today at 1 p.m. So if you're interested, you can tune in there. We're doing a broad update. We'll be updating about travel guidance. We'll be talking a little bit about these increases that we're seeing and how we're doing on vaccine. We also wanted to highlight that it is Chicago Restaurant Week. It's more than a week. It started March 19 to April 4. And obviously, like many things, Restaurant Week is looking a little different in Chicago, but please do support your favorite local restaurants. They're still recovering. You can get takeout. You can eat in. Restaurants are, especially if you've been vaccinated, restaurants are doing all the things to make their setting safe and making sure they're adhering to Chicago guidance. And I just wanted to, say thanks to Chicago Restaurant Week folks, because as part of the kickoff for Chicago Restaurant Week, they actually did bring some food to our vaccine operations center. So a lot of folks, who've been working just like around the clock from Chicago Department of Public Health, but so many other departments too, in terms of this vaccine rollout. Really appreciated getting lunch, because we don't usually get lunch. So really do check out Chicago Restaurant Week. It's one of my favorite events, and there are promotions around that if you have the means. And I think with that, we will close. One more reminder. If you know anybody 65 plus, please, 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 in the city of Chicago, help them get vaccinated. 312-746-4835. You can also go to chicago.gov/seniorvax, SENIORVAX. Can't emphasize enough, especially with cases on the rise. We got to get vaccine going for our oldest and most at risk for severe outcomes Chicagoans. So we're making progress every day, but this is going to be our last week before we have that big reopening into 1C. So thanks for tuning in, and we will see you on Thursday. Bye-bye.